The problem that we treat in the legs is called venous insufficiency, and basically the veins in the legs become, the walls become weakened and the veins dilate or open up, get too wide. And that causes problems with blood flow. The blood in the veins should be flowing back up to your heart, but when it becomes wide and open like that, because of gravity, blood starts to go the wrong direction. So you get some blood kind of pooling and moving back down toward the feet. Then that can lead to a number of symptoms. Typically the earliest symptoms are swelling and pain. The legs will start to feel heavy. Some people get cramping or restless feelings in their legs. And then it's progressive. So it can, from there, progress to where people get thickening in their skin. People can start to get discoloration of the skin. You can also see varicose veins, big dilated or spider veins in the legs. And ultimately it can progress to the point that it develops ulcers and sores in the legs. So the treatment involves using what's called radiofrequency ablation, which basically uses heat and radio waves to close down those vessel walls where they've gotten too opened up and wide. It closes them down, and it basically closes off the veins that are diseased, that are having a problem. So then the blood can be rerouted through the better functioning veins and start to flow and move again. The way it's done is there's a small catheter that will go inside the vein. So we do have to get into there almost like starting an IV and get inside of that vein and put the catheter in. Then it's hooked to a little machine that heats it up and causes it to make those waves that will then close down that vessel and close it off. And we close it down in sections so that it closes down the full length of that particular vein. And then that is permanent. It does stay closed off. We inject lidocaine locally to the place where we go into the vein, and then we do inject some fluid around the vein itself with some lidocaine for the procedure for the heated part, so that doesn't hurt or cause any discomfort. There's really not a big recovery period. The day of the procedure, we want people up and walking on that same day, up and moving around. Some people do experience a little discomfort on the day of the procedure, but most people start to have improvement of symptoms within a few days to a week, and then return to their normal activities within about a week or so. The first benefit would be improvement of those symptoms that you're having now. So the pain and swelling, those will get better. A lot of people just say their legs just move easier. They may not have even noticed that their legs felt heavy before, but now they just feel like they can really move better. And then long term, as I mentioned, it's a progressive disease. So it will prevent that progression down to the point that you start to develop some real damage to the skin, damage to the tissues in the legs, and ultimately sores that can lead to infection and real bad problems down the road.